Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
Hello everyone, this is Lukas and I look after corporate healthcare at GPDQ. I have our clinical director on with us today, Dr. Kathrina and we are going to talk about menopause. But if you just scroll past it because you're a man and it doesn't apply to you, please do tune back, as this is also a conversation about you, my man.
Thanks, Lucas. So yes, today this is a conversation for everyone about menopause. We're going to start off by just giving some statistics on menopause and explain why exactly it's important for everyone to have an understanding on the condition and not just women. Then we're going to explain a little bit about menopause and premenopause, and then we're going to raise the awareness further by giving some symptoms on menopause.
Great. Well, let's get started. So could you explain what we will be talking about today?
Yeah, definitely. So as I said, menopause is not just a female issue, it's an organisational issue. Managers and colleagues should be aware of the condition to make a working environment more supportive. And to highlight this, what I've done is just take some statistics from the government websites and government report on menopause, and also from the Faculty of Occupational Medicine. So first statistic to highlight how important menopause is in the workplace and how important it is to be aware of menopause is that menopausal women are the fastest growing demographic in the workplace. Excuse me. Secondly, 8 out of 10 women who have menopause are in work. Thirdly, 3 out of 5 menopausal women said that their menopause may be having a negative effect on them at work. 1 out of 3 women who have menopause may have taken sick leave because of their symptoms of menopause. And lastly, 1 in 4 women who have menopause said they had considered leaving their jobs because of the impact on menopause in their workplace.
Wow, this is 25% of people, of women thinking about it. So can you explain what exactly menopause is?
Yeah, definitely. So menopause is a condition that is a natural part of aging for women. It's a condition that may last premenopause and menopause together for up to 15 years. So it's a significant period of a woman's working life, of her life in general. And it's the period in her life where her periods come to a stop. Normally it occurs between the ages of about 45 to 55, with menopause averagely being about 51 to 52 years in the UK. So that's menopause is when your periods stop, and premenopause is the period before your periods stop.
So what are the symptoms of menopause?
Thanks, Lucas. So it's really important to highlight these symptoms because I think there's a common view that a menopausal woman is one who's having hot sweats, which she might be doing and just sitting next to a window trying to get some air. And of course, hot flushes are definitely one of the symptoms, but menopause is not limited just to hot flushes. So hot flashes, palpitations, which is the awareness of your heart beating, fatigue, sleep disturbance, night sweats, skin irritation, irritability or mood disturbances, poor concentration, and then you've got needing more toilet breaks or potentially even increased urine infections. So there's a whole myriad of symptoms that you can see would definitely impact on somebody's well-being and their ability to be in the workplace.
Absolutely. And what should you do if you are suffering with symptoms then?
So if you're suffering from symptoms, I think firstly, the reason we've raised this is because if you're suffering from symptoms, this is a problem that there shouldn't be a taboo about talking about this condition. So for men listening to this and understanding what women are going through, the first step is having an understanding work environment for women who are going through this. And then the second step is for the woman herself to seek further information on menopause, and you can find lots of information on the NHS websites. And thirdly, if you're not getting the information that you need, or you've got further symptoms, then speak to your GP. So either your NHS GP, one of us, or the GP at your work clinic. And so speak to somebody and get help, because there's lots of things that can be done to help you with your symptoms of menopause.
Totally. Yeah. Once again, being proactive about your health is where we want to be, and particularly about that. So just to go and ask for that help. Well, thank you so much. Super valuable for all, women and men, obviously. So hopefully that was also lots of takeaways, and definitely the proactivity of that. So thank you all for listening. Certainly tell your friends, and do remember this week to put yourself and your health first.